Excellent. I will kick things off then for us. Good afternoon to everyone on the East Coast. Good morning to those of you Central and Pacific time. So grateful to have you all joining us today. My name is Genevieve Kessler, and I am the Director of State Advocacy for the International Rescue Committee, as well as State Strategy Lead for the Refugee Advocacy Lab. Today we have participants from all over the country, at least 15 states by last check of our registration. So really grateful to have all of you with us today and wanting to participate in this information session. As you all know, just a few months ago, we watched the fall of Kabul and the dramatic images of evacuations taking place in Afghanistan. What we saw in response were community leaders and state leaders really proactively respond to this moment, sharing messages of support and really illuminating some of the community commitment to resettlement in response to this event. This took a number of forms as well, centralizing state websites for resources and donations, and working directly with Afghan community and resettlement agencies to streamline any processes and address specific needs. So today what we're doing is sharing two particularly strong examples of how states responded to the situation. I am pleased to introduce you to three presenters that we have with us today. Kit Taintor from Colorado, who is the Senior Advisor, New American Integration. We also have representing the state of New Jersey, Deborah Cornavaca, who is the Deputy Chief of Staff for Governor Phil Murphy, as well as Elisa Neira, who is the Deputy Commissioner of the New Jersey Department of Human Services. Kit, Elisa, and Deborah will be sharing with you the proactive steps that their states have taken in the last few months and what they hope the outcomes of this will be, or what they have seen already as an outcome. As a quick note for our audience, the presentation is being recorded and it will be shared after the fact. We will end the recording at the conclusion of the presentation before we open up for Q&A and discussion. So really, welcome your feedback and questions that you have about how this all came together. And just as a note, and out of respect to our speakers and presenters and for the recording, please keep yourselves on mute. If you have any questions, you can submit it through the Q&A feature on the bottom of the screen, and we will be able to address that during the designated question and answer time after the presentation. Thank you so much. So I will turn it over to Kit now. Kit, over to you.
Hi, good morning, everyone. I'm happy to see so many familiar names on the attendee list, and thanks to IRC and for New Jersey for also being participants in this call. I know that Afghan evacuees has been a big topic for all of us over the last couple of months, so thanks for taking your time out of the day to learn a little bit about what New Jersey and Colorado have done in anticipation of this historic arrivals. So just as we get started, a little bit of level set so everyone's on the same page about Colorado in particular as we participate in the refugee resettlement program and as we participate in the resettlement of Afghan evacuees. Colorado in general resettles about 2 to 3% of the national total of refugees that come into the United States every year. So I like to say we're like a medium-sized state in terms of arrival numbers. The other sort of note that I would say is that we do have a healthy existing Afghan population. We're not as high in arrivals of Afghans as some other states like Texas or Virginia or California, but we do have a really healthy existing population, both refugees that came in the past 2 years. Actually, Afghans are our highest population of refugee arrivals over the past 2 years, but also, folks that came over on different immigration visas or came over to work and reside in our state. It is also important to recognize that in Colorado, about 90% of our refugee arrivals do arrive in Metro Denver. So we're also sort of fortunate in some ways in that we just really have one metropolitan area that we really need to focus on. We do see Afghans move to Colorado Springs, but in much reduced numbers as we compare it to our Metro Denver area. Other sort of level setting things for you guys to recognize is that our Colorado Refugee Services program sits within our Colorado Department of Human Services in the division that oversees a lot of the TANF programming. I know this might be similar to where your refugee programs sit, but it's always good to know sort of operationally how that works here in our state. And then the Office of New Americans, which I'm in the process of standing up, sits at a sister agency at the Colorado Department of Labor and Employment. So we also really have strong partnerships between Human Services and Labor and Employment, which oversees a lot of our employment and training programs here in Colorado. Those partnerships exist because of these two unique offices and also the dedication of the leadership to ensure that our Colorado is a Colorado that for all, and that we are welcoming immigrants in the way that we know will drive mutual benefit in our state. The other thing, and Genevieve mentioned this, is that, currently I have a dual role. And so while I am standing up the Office of New Americans at the Department of Labor and Employment, I also do sit on the governor's policy team. And I think that has been really helpful as we determine how we're going to react to Afghan evacuees in order to operationalize and sort of draw in additional cross-agency partnerships and municipal and local government partners as well. So the Office of New Americans just in general serves all immigrants, while the Refugee Services Program is just refugee or our refugee eligible population. So there's intersection between those two offices. But when we first learned that we first learned about the evacuations in Afghanistan, and we really looked at what we would need to do as Colorado to help the federal government in these evacuation efforts, the Office of New Americans really stepped up and stepped into a leadership role here. And that was particularly because at that time, if you guys can remember all the way back to August, a lot of the humanitarian parolees did not yet have eligibility statuses that would make them eligible for a lot of the things that the refugee program does, or a lot of the other programs that exist in our state. And so we were thankful to have the Office of New Americans already have sort of a good landscape analysis of what systems and programs might be available to them, considering that they at that time at least would have been, for all sort of intents and purposes, falling into some of our programs and services for our undocumented population. The other thing that we really realized in August was, not only were we stymied a bit by the eligibility of folks at that time, but we also recognized that our refugee resettlement infrastructure was probably going to be inadequate for the size, the scope, and the pace of arrivals that we anticipated. And so what that drove us to do in August was to set up a unified command group that could draw on cross-agency partnerships, that could pull local governments into the mix, and that could pull additional nonprofits that help out in disasters and emergencies into our matrix, if you will, of folks that are able to help out in this particular circumstance. So in this time in early November, our unified command group has been meeting on a bi-weekly basis. And we have a number of tasks that we identified as being really key for us to look at. One, of course, is short-term housing. Another one would be long-term housing, employment, how we got people cash assistance, how we stood up philanthropic efforts, what our health response would need to look at, what legal services we needed to have in place, knowing that people did then and still now need to seek asylum. So really being focused on those need areas that we went ahead and identified very early on in August as being places where we would need to pull on for additional partnerships. The Unified Command Group is run by our Division of Homeland Security and Emergency Management, and specifically in that emergency management infrastructure. And why we're really thankful for their participation is that this is what they do. They stand up things really quickly, and they implement things quickly, and they rely on a whole host of state government partners as well as municipal partners in times of crisis. And this is something that we felt like rose to that level to be a situation in which we really needed to pull on a lot of folks' expertise that sort of lived in that circumstance, definitely through the past couple of years with COVID, and definitely sort of in their portfolio of expertise and skills. So we're happy to have them. They help us in every way, from coordinating and planning and running the meetings, which has been really helpful, I think, for the refugee services team, and especially for me as an office of one, as we build partnerships across our state agencies to really rise to the moment, if you will. Part of our UCG, or our Unified Command Group, also includes our other state agency partners. So this would be our Public Health Department, which currently oversees the Refugee Medical Screening Program, but then of course also oversees such important programs as immunizations, TB testing, all those other sorts of elements that we need to make sure are in place as we welcome the Afghan evacuees. Other participants do include our Department of Labor and Employment, which again oversees the employment and training programs, including our workforce centers throughout the state, which at this time have a bevy of resources and grant programs that folks are eligible for as they arrive to help people get on the track to meaningful employment and hopefully reconnection with their careers. Other state agency teams, of course, include Human Services, which does house the refugee program, but then does house other really key programs for Afghan evacuees, to include things like food assistance and childcare. And then the other partners that we have sitting around the table with us from the state agency lens is also our Division of Profession and Occupations, which oversees a lot of the licensing requirements that that people need to go through if they want to rejoin their careers, and their careers require an occupational licensure. So it's been really helpful to have all state agencies around the same table, receiving the same information and bringing in their unique expertise and partnerships to weigh in on these particular items as we workshop different ideas and workshop different resource gaps in order to be effective in our whole of state government approach. The other folks that sit on our UCG are, of course, the resettlement agencies and other partners within the resettlement agency infrastructure that have been really key to making sure that we stay informed and in collaboration and coordination with them. Other nonprofit partners include folks like the Red Cross or Salvation Army, or other organizations that operate as the Colorado volunteer organizations involved with disaster assistance. So I'm sure you guys have those in your states as well. But again, these are nonprofits that are used to, for instance, providing food to displaced populations, whether that was the Katrina refugees, or maybe that was people that were displaced because of floods or fires here in our state. So we're really thankful for their expertise and their ability to dive into a lot of these projects. Other partners that we have at our UCG, or again, our Unified Command Group, are our municipal partners. So the city, our city partners that we know are going to receive a lot of evacuees. Those folks sit around the table with us, as well as our county governments. Colorado is a state supervised county administered state. So our county partners are the ones that actually do the TANF eligibility applications and things like that. So it's been important to have them as part of our partnerships. So we have about 50 people who join these calls, again, Tuesdays and Thursdays, and are really sort of trying to solve issues in real time. And so I thought what I would do today is sort of go over our last meeting so that you guys can see the meeting minute notes from our last meeting to get a good idea about what we cover as part of this model. So I'm going to share my screen, and what you see here is our Unified Command Group. We're calling it the Afghan Response and Support Working Group. We've got a set agenda every week that includes a refresher of our mission, our key task, conversation around our resource gaps that we're seeing in real time, what next steps will be, and again, closing comments from leadership. As a reminder, the leadership of our Unified Command Group are our State Refugee Coordinator, Noyes Combs, myself sitting in for the Governor's Office and for the Office of New Americans, and our Division Director for Emergency Management. So we set up our mission to be in support of the refugee resettlement agencies and the federal government to determine housing, health, food, and cash supports to support with newcomer stability. So as we considered and conceived of this working group, we really wanted to stay in commitment of the existing refugee resettlement infrastructure. We weren't interested in recreating the wheel per se. What we were interested in doing is bringing new partnerships and new funding sources to the table to help the resettlement agencies and the existing resettlement infrastructure begin to respond to this unprecedented pace and number of arrivals in our state. So again, we pulled up our key task and our key task for the group that we set in August and have continued to stay focused on those. One of those was short-term housing and food. And so we have a working group that operates underneath this particular group to identify what short-term housing options might be. We've had a team from emergency management negotiate upstream what short-term housing arrangements may be available, whether that's through working with Airbnb or a lot of our hotels or other partners here in the state that might be able to offer a lot of these short-term housing situations. So for instance, we've got a long running list of hotels that have agreed upfront to some pricing negotiations that resettlement agencies can use to operationalize when they don't have a US tie or another individual that these newcomers can stay with. That way we don't have the resettlement agencies trying to find these prices and these hotels on their own, but we went ahead and centralized that for them. We have been working with our state emergency operations center, so that's that SEOC that you see there, to identify and secure food. A lot of that work has been working through all of our food banks here in the state that have been delivering food boxes to new arrivals, whether they are staying with US ties, whether they're in Airbnb, whether they're in a permanent long-term situation, or whether they're at a hotel. And this has been hugely helpful to work through a centralized model to make sure that our food banks are able to lean in the ways that they can and the ways that they really, really want to be able to do. We were able to secure a warehouse for additional donations in response to what we were hearing from our resettlement agencies was an overwhelming amount of supply of donations. And so we were able to set that up. Again, the SEOC and our teams over at emergency management were able to do this on their own, which was really helpful to the resettlement agencies. And so we do have a pretty large warehouse that has been identified that will start accepting donations pretty soon. We looking in long-term housing and cash, part of the outcomes of this particular work group was to secure state funding for short-term housing. So we were able to do that through our existing rental assistance dollars. So we're very excited to be able to offer the resettlement agencies with additional cash on hand to allow them to pay rent, knowing that permanent and long-term housing is the ultimate goal of what we want to see for new arrivals. And so by working through this unified command group, we were able to bring our Division of Housing on board and be able to tap into some of their resources that they have for all Coloradans, including newcomers, in order to stabilize families on their way to success. We were able, through this group as well, to do a number of presentations to groups like our apartment association here in Colorado, including up at a conference that our housing partners were having to make sure that everybody knew that these Afghan evacuees were coming in, and we were discussing pain points as far as credit history or background checks or things like that in real time with all of our potential landlords, and again, taking the burden off the resettlement agencies of having to do that on a one-on-one basis. Health, we were able to secure additional funding both through state and philanthropy resources to be able to stand up some additional overflow clinics for a lot of the incoming arrivals, knowing that we want to keep to our task of doing refugee medical screening within 30 days. So again, this task force meeting that included our local public health agencies, that included some of our great health focused foundation partners, to include our Department of Public Health and Environment, to include our federally qualified healthcare centers that work alongside refugees. We were able to sort of figure out what the gaps were and then provide for those gaps, again, through some private philanthropic giving and also some state giving. Employment services was another task that we lined out for ourselves. And so this is where we're really thankful for our partnerships with all of our local workforce centers or American Job Centers, as your state might refer to them, and really stand up some great referral processes to, again, take the burden off resettlement agencies for having to offer employment services for everybody that's coming in, knowing that there's so many state and federal resources going to our workforce centers to allow people to upskill, reskill, and next skill in the wake of the pandemic, if you will, that Afghan evacuees could tap into. So that process has been working very well with the workforce centers, and we're really excited to be able to bring them along in partnership through a lot of the work of our UCG. Philanthropy, this is also a category that we've been working on. Colorado did set up the governor's Colorado Afghan evacuee response and support fund. We're up to about $1 million in giving, and we're really excited to be able to distribute that out for some of the places that state funding could not step in, to include things like mental health services for evacuees and legal services. We did not have the vehicle within the state to sort of move funding through for these purposes, and so we really focused on those for our philanthropic efforts. And we're really happy to have the partnership of the governor's office in particular to do a lot of the fundraising for us. So again, taking some of the burden off both our philanthropy teams as well as our resettlement agencies, and sort of coordinating how that philanthropic giving happens during this time, to basically be able to harness the interest of all of our Coloradans and Colorado philanthropy funders into one sort of fund, and be able to respond in real time with changes that we're seeing on the ground, or, you know, for instance, changes in federal eligibility requirements that sort of change where we want that giving to go. The next piece in our UCG that is important to note is that we do have a joint information center that operates as part of the UCG, and so we call this the JIC. This is really similar to what I'm sure a lot of your states have stood up as far as COVID communications go. And what this allows us to do is centralize a lot of the communications that go out to make sure that all of our partners, from our local public health agencies to our municipal liaisons to our constituents at our congressional delegation offices, have the information that they need to make sure that that information is both correct and consistent across the field. All of this information is being hosted on our Colorado Refugee Services Program website, and it's been really great to have one source of information that's updated on a weekly basis that we can point our partners back to. So again, as part of our UCG, we have federal partners. They're able to give us real-time updates as part of this conversation. So our regional representative from ORR does attend these meetings. And then we also are thankful to have the partnership of our regional offices for HHS, FEMA, and even USDA sit around the table and help us workshop different ideas and different infrastructures that we want to set up for our Colorado team. Again, we have our municipal liaisons as part of this work group. They're able at this point in the meeting to bring up issues that they're seeing. It's been huge to have them at the table to give us real-time information about what different opportunities might exist through city funding or even county funding to support the efforts that we're doing. And so we're really thankful to have their participation as well. And then, as always, part of the meeting also does include an update from our resettlement agency liaisons. They have reported back that it's been really helpful to have one place that they can invite people, partners across local government, or, you know, with some of our disaster organizations, to have one place to update people in real time. And that helps them kind of decrease the amount of emails that come in asking the same question about numbers of arrivals or pace or things like that. So again, it's been a really nice kind of contribution to this meeting. We also have a chance to talk about resource gaps, what's coming up. And again, the folks around the table are able to respond in real time. So if a resettlement agency said, we need winter coats, for example, other folks on the team can sort of lift up that request and take it off the resettlement agencies and drive some of their resources and some of their donors and their givers to those sorts of needs in real time. So this has been kind of a really quick and dirty overview of what we've been doing in Colorado. Again, I shared the outcomes and the notes from the meeting that we had yesterday. We'll have another meeting tomorrow, but I think our unified command approach to this has brought has capitalized on the interest that we've seen with a lot of our nonprofit and community partners to be a part of this, and really activated their strengths and allowing them to participate in, you know, this sort of stand up refugee resettlement infrastructure in real and impactful ways. And I think that we've all really benefited from a coordinated approach, and that we've been able to bring additional resources, whether that's through state funding or philanthropic giving, or even time and resources of some of our other nonprofits that are agile in this work to the table. So I will stop there. I know that we have a lot of time for questions. I'm really sorry if I did a bit of an acronym soup in there, but I can work back out and make sure that all of the state agencies have been appropriately attributed, so you can understand who we have at the table and potentially replicate in your own state. So thanks, Genevieve. I'm not sure if I'm passing to New Jersey or not, so I'll just pass to you.
Thanks so much, Kit. Really appreciate that and appreciate the rundown of not just the back end of how this came together, but the meeting notes to show how it's actually playing out for all of the participants. As a quick note for anybody who joined on just a couple of minutes late, we are recording this, so if you miss anything or you want to be able to go back and review the content later on, we will be recording the presentation segment of today's training, and then we will conclude the recording after the presentations have done and move forward with questions and discussion. We will be sharing the recording, of course, out with all of you after the fact. And with that, I will turn things over to Deborah and Elisa.
Good morning, good afternoon, everybody. Thank you so much for the invitation to be here today and for us to be able to present on the behalf of the great state of New Jersey. We're thrilled to be here and share the work and learn from you, as well as share what we're doing, and to be supporting the efforts to resettle our Afghani friends is really an honor. I'm just going to kick it off very quickly with a brief overview and then turn it to Elisa to get a little bit more into the weeds around the work that we're doing on the resettlement. But we recognize first and foremost that this being a federal-led effort, we wanted to make sure that we were coordinated at the state level to provide support into the feds any way that they needed it, and to our guests any way that they needed that. So we wanted to make sure that we were ready with all the pieces coordinated, and that if the need was expressed, we could quickly articulate an answer to them and get them what was most helpful. And that really was that intermediary piece between what the feds provide and do and what the needs are on the ground. There's a big gap, and we wanted to make sure we were ready. And in doing so, we wanted to make sure that we were facilitating our work in such a way as to provide a warm handoff and alignment when people move off base into resettlement. And so our efforts were really always twofold: take care of people on the base and prepare them for resettlement in the most advantageous way. And we found along the way that there were many areas and spaces where we could, as a state, lead efforts that, to what was previously talked about by Kit, take things off the federal plate because they had to focus in one space and we could handle other particular pieces. So I'm not sure if the screen is coming up, but I wanted to just run through very quickly the structure we created. I suppose I can share mine, I think. You're sharing it, thank you. So what we had done early on, the governor established a task force which he signed into an executive order on August 24th, pretty early in the process. This was going to be an interagency, so a state level government set of department representatives coming together on a regular basis. We started every day, 7 days a week. We started every single day, no matter what. We then went down to fewer days a week, and then we also divided up different groups meeting at different times. But the most important thing for us was bringing everybody together on a very frequent basis, because the circumstances were changing so rapidly, and to get everybody fluent in the context of the way the federal government was working, the way the military base was working, and begin to streamline communications and build those relationships amongst all of these departments, and also with the federal liaison on our calls. So this is a lot. Our calls at regular every day at 4 p.m. would have a lot of people, but there was a very organized cadence, as is the style of military, to get us through it efficiently. And from these calls, a lot of break-off calls and sub-teams developed to handle specific issues such as child welfare, education, and health. But hopefully this is a useful list for all of you, and I think it reflects a lot of what Colorado was talking about in terms of the holistic approach needed to be taken, that literally all of these departments were bringing things to the table that were helpful and informative and are part of our processes. The rules of the task force, as you'll see in the next slide, were first to support our guests in Liberty Village, which is the name of our village, which is on our base, and also to support the federal government's efforts and where they had gaps in what they could provide and do. We wanted to make sure that we were managing our internal efforts and coordinating those, and that's a ongoing challenge, because there are so many people so eager to help that they will often run with an idea in one direction, not bring it back to the coordinated group. And the next thing you hear, there's a barbecue for 10,000 people being planned on a Friday night, and you're not exactly sure how it happened. You try and rein it back into the group of shared information. But that was one of our biggest efforts, was to make sure that we could manage our internal pieces to be coordinated. And the next is obviously to coordinate communications, create streamlines, get the right people on the right calls, and create the right spaces for the necessary conversations, and make sure that we are also giving our departments within state the right authority to proceed to lead on certain issues where it was needed, instead of feeling like they had to always wait for somebody else to bring a plan forward. So we really wanted to make sure our state level departments and employees were empowered to do that work. We are overseeing a lot of the vital support, the healthcare pieces. This is everything from COVID vaccines to regular vaccines to health screenings to lots of births. Our First Lady in the state of New Jersey is extremely involved in maternal welfare and maternal and child mortality. And so she got right in there with their program of Nurture NJ to make sure there were doulas available, really rounding out the support that the federal government might provide and giving them a more holistic set of care and options, making sure that it was language appropriate, culturally appropriate. So any way we could connect that and then oversee certain pieces of the program, we did. And then obviously to create these mechanisms for organizations and individuals to provide support. And here, this is one place that the governor's office, along with our colleagues in other departments, have been really useful in bringing in the Afghani community, the South Asian community writ large, who are so eager to help, and it extends beyond that, but in particular Afghani communities in New Jersey, so eager to help, but needed direction, coordination, and they needed to be read into what was happening so that they felt comfortable that we were taking good care and being attentive to the needs of people who they consider to be family on the base. You'll see in the next slide that our areas of coordination really cover the gamut. Healthcare and medical was certainly a forefront of our mind coming in during COVID, realizing that many people didn't have other vaccines that could lead to outbreaks. Making sure that people had health screenings, that people with ongoing medical issues were getting medicine, all of those things had to be set up. On-site supports is varied and it changes a lot depending on what the needs are and what the next move is as we progress through the base supports, and also making sure that what we're doing on site begins to prepare people to get to resettled. Donations has been a huge issue. Like in Colorado, there have been warehouses. We've tried to really focus them on what's needed at the time. So as our weather changed in September, we did the blanket drives and the coat drives. Next month, as we begin to set up education spaces on base, we'll be doing a school supply drive. We've had a lot of great volunteers through our nonprofits bring recreation to the base and begin to offer people conversations with those who live in the communities in New Jersey so that they can begin to envision what life will be like when they move off and get resettled. And then right now, one of our current priorities is working on education. It's our hope that all of these efforts are helping prepare them to move to resettlement. And we recognize that we may in New Jersey resettle people who are from the base in New Jersey into New Jersey. There's a slightly lower lift there because there's more familiarity being built early on, but we're also receiving people to resettle from different states into New Jersey. And so one of our hopes in these conversations is that we're aligning with what you're doing, and that when we are receiving people from wherever they're coming in from, we know what they've been prepared with, what needs they have, and that all of our support organizations, our resettlement agencies, along with that network of nonprofits around them, and then the individual donations and people wanting to support are aligned and ready to go to welcome them fully into our communities to set up their households and lives in New Jersey. With that, Elisa, I'll turn it over to you to take care of that focus piece on the resettlement part.
Yes, thank you so much, Deborah and Kit and Genevieve and IRC for hosting us today. Before I sort of start with the what we are doing on the preparations on the resettlement side, I just wanted to give everyone a quick overview of what that newcomer landscape is here in New Jersey. For fiscal year 21, for federal fiscal year 21, we in New Jersey welcomed and are welcoming over 5,000 unaccompanied children who are arriving from the southern border. Last year, we also welcomed 542 Cuban Haitian entrants into New Jersey communities. As you know, and many states probably also welcomed some of the MPP families that had been seeking asylum at the border, but then were turned around and were staying in Mexico until they can process their asylum application. And so those families at the beginning of the Biden administration began coming to New Jersey. Numbers on those families is hard to sort of track, but we know through our legal services providers that those families have been arriving in New Jersey as well. And then as far as the Afghan evacuees that we are anticipating, and we know that those numbers are still sort of preliminary and can change. So far, the number that has been allocated to New Jersey is around 700. And for everyone's sort of awareness, in terms of refugee and SIV arrivals last year in New Jersey, that was around 133. So certainly that has been in the bucket of all of these newcomers. That number hasn't been as big as, for example, unaccompanied minors and Cuban Haitians who are arriving to New Jersey. As far as what the New Jersey resettlement structure, which is on the next slide, looks like, we in New Jersey are uniquely situated, and our program is administered a little different than perhaps some other states on the call. We share this responsibility with our Department of Human Services with a designated replacement agency, which is the International Rescue Committee. And so we split responsibilities and roles. The New Jersey Department of Human Services is responsible for the resettlement, the medical coordination and medical assistance aspect of resettlement, while the International Rescue Committee works with other refugee resettlement agencies and social services supports agencies to implement and deliver the social services support and the refugee cash assistance. And so it is a little bit different than maybe other states and how you are structured. In the next slide, I can talk a little bit about what that coordination has been on the resettlement side of the house, as we have been preparing to welcome Afghan evacuees. I think, we are also very uniquely situated, and I think we have the advantage of understanding sort of what is happening, at the military installations, because New Jersey is one where we have, over 11,000 Afghan evacuees at the New Jersey base. And so I think that has been helpful for us to get information maybe faster about the Operation Allies Welcome, and also how those things may impact resettlement. So I think it's been helpful to understand sort of what is happening at the bases as we are getting prepared. What we have set up in New Jersey, we do weekly check-ins with our New Jersey resettlement agencies. There are 3 in New Jersey. And there's 4 APA sites that will be assisting Afghan evacuees. And so for those meetings, it's really just a time to one, talk about any challenges, concerns that they have, that they need guidance with, but also a time for us to really share what information we have. As you all know, information around Operation Allies Welcome is, changes constantly, and we are, getting a lot of information on a weekly basis. So making sure that we're connecting with our resettlement agencies is very important. And identifying what challenges, what needs of immediate resources they may have, and sort of helping in that short-term, long-term planning. I think Kit mentioned this earlier. We also, in our Department of Human Services, have an Office of New Americans, which was established about 2 years ago. And so we are in the process of integrating our refugee resettlement program with our Office of New Americans. And we're really excited about that transition, and making sure that we are integrating all of those programs together. In terms of, we also, at the Department of Human Services, we also serve as the Medicaid agency, the SNAP agency, TANF, and childcare, which is really valuable because as the AARs and Afghan evacuees population, particularly those who are here on humanitarian parole, as they have become eligible for some of this mainstream services, we are also the agency receiving that guidance from our federal partners. And so it has been really helpful to make sure that, one, we are training our local county. We in New Jersey administer many of these services through our county board of social services. There's one in every county. And so making sure that we are training them, making sure they are aware as to what is happening, the normal process of how they enroll individuals into our benefit programs is a little bit different for this population. For example, some of our Board of Social Services are used to looking at verifying immigration status through the SAFE system. And we know from our federal partners that there is a lag right now in that system making sure that our eligibility workers are aware of the kinds of documents that some of these individuals may be arriving with to prove their eligibility. And in turn, we also are making sure that our resettlement agencies have, materials and resources and toolkits when they're helping individuals navigate how to enroll into the programs, into these different programs. And so that has been very helpful because everything sort of sits within our department. I think there was a question in the chat about expanding capacity and resources, and obviously that has been at top of our mind. We are right now looking at ways to grow our team within our refugee resettlement unit here at the department. We are in the process of onboarding, hiring and onboarding new members to our team, and also thinking about what are other needs that we may have that we need to also think outside of the box of the normal structure of this office because of the current situation. We also, on the medical side, we provide the domestic health screenings through partnerships that we have with our federal qualified health centers. We have 3 contracts with these local FQHCs to provide the domestic screening that individuals need to do within that, those first 90 days, and making sure that we're looking at ways to expand their own capacity so that they can serve more individuals and ways to grow those partnerships across the state. Right now, if anyone is familiar with the state of New Jersey, we have these FQHCs who are primarily situated in our central and northern region. And so there's a great need for us to be able to expand that to our southern region of our state to make sure that we have services on that side of the house. As far as what that interagency coordination has been, I think that the task force has been very helpful to make sure that we're not only sort of talking about the kinds of needs at the base, but also helping our colleagues at other departments understand what our role in resettlement is and what the different needs are going to be. So for example, we have done briefing with the governor's office and some of our sister agencies to make sure that they understand what our resettlement program is, how the Operation Allies Welcome deviates a little bit from normal resettlement and what that looks like. And it's been really helpful to sort of have those conversations and identify resources on the shorter term, on the long term. I'll give you an example. Just last week with our colleagues at the Department of Education, they meet with their county school superintendents on a bi-weekly basis. And so they had us join one of their meetings. We were able to brief all of the county superintendents on the program and also on Operation Allies Welcome, what those resettlement numbers look like in New Jersey. Some schools have already started to enroll some of the children that have school-age children that are arriving with families. So it was really helpful to start to create those contacts and talk about what kind of systems we need to have in place when we need to, for example, troubleshoot any challenges that any of our resettlement agencies may be having on the ground when trying to, for example, enroll a child into a school. We know that these families are coming in very unique circumstances, and we also have a huge language barrier. New Jersey is not a big a state that has a lot and has been we haven't been on that top list of states that have welcomed Afghan Afghans over the years, and so we do have a smaller Afghan population. So we have identified some areas where we really do need to think through solutions as far as how we can provide translation and interpretation and the like. In terms of collaboration and coordination with our Department of Health has been key, not only for the things that are happening at the base. They have been very helpful in assisting the base in contracting with local area hospitals who are sort of doing the medical treatment that may not be something that can be provided on base, or they are doing some of the baby deliveries that, you know, there are hundreds of pregnant women, many of them who are in their third trimester, and we have already seen a significant number of births in New Jersey. And so they have been key in sort of that facilitating those conversations with our New Jersey hospitals and other health providers. But they have also been really great that the local health departments here in New Jersey have vaccination clinics for individuals who are uninsured. And so they have been really great at plugging in as we have needed, for example, assistance with vaccinations as individuals are coming into the state, particularly in areas where we don't have a designated FQHC for this particular population. So that has been very helpful. And on the next slide, these are sort of the planning considerations that we have that, you know, we talk on a weekly basis about, you know, what is some of these things we've already assessed what our capacity is, are working to identify what our gaps are and explore solutions, whether it's within the Department of Human Services with some of our sister agencies. And here are some of the things that I know have been top of mind for us, and I'm sure for you as well. You know, we've certainly been concerned about the volume and cadence of resettlement. You know, this is our resettlement agencies are not getting a lot of time in advance to prepare for an individual or a family's arrival. Housing availability, you know, we were thankful to the federal government for being a little bit more flexible as far as the mile radius from a resettlement agency as to where individuals can resettle, and being able to identify other pockets in our state that may have more availability and capacity. I already talked about language access. We have already started to make assessments with our, we have some contracted legal services providers that are working already with immigrant populations and sort of identifying what kind of capacity they may have, because we know that for a big number of this population, they still have to go through an immigration pathway in order to adjust their status here, and they have to apply for asylum. And we know that that is a lengthy process and one that requires making sure that they have legal representation and support. And certainly, and most recently started having the conversation around workforce. You know, the opportunity we have here as we are welcoming individuals who may have different types of skills, and how we capture those, and how we also capture interest from employers who are already finding ways to connect with us as to, you know, we have needs, and how we may be able to plug in this population to some of those needs. So that has been sort of the way that we have approached our coordination. Certainly so many things are changing constantly, but there are some things that we know are definitely things that we're going to need sooner rather than later. And so that has been a little bit of what is happening here in New Jersey. So I'll stop there and see if anyone has any questions.
Thank you so much, Elisa and Deborah, for all of that information. We do have a couple of questions that have come in through the chat. So at this point, I just want to extend a lot of gratitude to our presenters. I think we will end the recording here. And for those of you who would like to stay on the line for the remainder of the session, we'll close out at the top of the hour so we can send everyone on their way and be mindful of your time.